Radio. You're listening live for another talk show series, and this is going to be specifically talking about some government programs for the underinsured and uninsured folks, and to give the audience and the viewers and listeners an option, or at least some of the options that are available in the marketplace. I did cover a lot of the stuff in terms of senior health and a lot of programming that feels more towards the senior markets. Today we're going to talk a little bit more about the other markets that are, a lot of people need insurance, and there's always question like, what do I have to do to get insurance if I can't buy it, if I can't afford it, whatever the case may be. This particular program is something that is dear to me personally because I've started actually in the industry doing this particular job and talking about these insurances in the communities that I've served and serviced in the past. And today specifically, I've invited a guest speaker and an expert and an industry specialist, one of our own, that worked in a similar place, in a similar company that I actually started with. She took over my torch there and the baton and took over in the plan, and she's been there, doing a great job, an excellent job in the community. And today also will be special because we will have a bilingual session, so we will talk in English first, and then we will address the audiences also in a specific community. Today we'll be talking specifically in Arabic and Moroccan dialect. There will be in the future there'll be shows that will be specific to different markets and different language specific needs. So the next one will be actually in Spanish with a guest speaker that will be talking about insurance in Spanish. And so today, again, we have guest speaker Rachida Chellal, and she is actually, again, as I stated, an expert. I can give her all the kudos, but I think the best person that can talk about Rachida is Rachida. And Rachida, why don't you tell us a little bit about you, your experience, and just a little bit in general.
Yeah. Hi, how are you? My name is Rachida Chellal. Actually, I start in this industry in 2004. I start in Health Plus as a member service. Then I transferred to outreach department. I worked there for 1 year. Then I didn't like it, to be honest. Then I applied for a marketing department, a job. Then I start from there. I speak 3 languages. I speak Arabic, English, and French. And I've been doing this job from that time to now. And I worked for three insurance company. I start with the Empire Blue Cross Blue Shield. Then I resign and I got the job with United Healthcare. Actually, I get laid off last year. I stayed home for 6 months. I told myself, let me relax a little bit. And then I got a job 2 months ago now with Affinity.
Well, again, I mean, it's unfortunate this stuff happens, but the good news is you've helped a lot of people. I'm pretty sure since that time to this time to date, you've helped. And I know in our business we do a lot of outreach, as part of the sales component. And there are a lot of people that need the coverage, they need the insurance, and unfortunately they just cannot get it. They don't know how to go about it. And so agents in the community do provide a service. And especially in some specific markets, it's a little bit more. You have a lot of immigrants, people that come in, that may not know what's available, who's qualified, and so on and so forth. So today we're going to cover some of those things, and hopefully we'll give an idea for those that are watching and those that will probably listen to on the radio, as well as in the future. This could be a platform, and they can of course reach out to you, Rachida. And before we finish, I want you to give your information so people can reach out directly to you, so you can assist them. And I'm assuming you cover pretty much all New York City.
Yes. Actually, I'm a certified counselor right now in New York City. I cover the 5 boroughs, and I do all the plans, Medicaid, the Child Health Plus, Essential Plan, and QHP, which is Qualified Health Plan.
Okay, well, so that's actually what we're going to be talking today. Is there are different options. And depending on your age, depending on your financials, yes, on your immigration status, yes, there are different programs for different people. And so today we're going to cover those breakdowns. So let's get started maybe with Child Help Plus. what it means, and then, how does it benefit people who's, qualified for it. And let's take all the different stigmas and questions that people may have about CHIP. We call it CHIP.
Yeah, of course. Okay, I don't know if you know, like before when people they were applying for Medicaid, it wasn't affordable for everybody. Like you have to be you have to provide specific documents. You have to be legal in the country. You have, but now when after Obama came and he, Obamacare come up, the marketplace, it's affordable for everyone, and. For marketplace, you can have any income and you can be eligible. You can be documented or undocumented. You can be a pregnant woman, a kid. If you have if you have have a lot of money, if you're rich, you are eligible for this program.
You just have a different category, a different level.
It's just different categories, yes. The only thing, it's when you do the application, you have to provide your income, the size of the household, your immigration status, and then we do the application. And if you're eligible, then either you're eligible for free or you're affordable health care.
So, and this is for the Affordable Care Act. So this is the Obamacare specifically.
Yes, yeah. Actually, this is the only program right now.
Okay, correct. Now, but people do qualify for Medicaid. Obviously, if they do have Medicaid, they have to select a plan that's through the state directly.
But through the marketplace, yes.
Through the marketplace. Now, so the ACA is more for the adults, I'm assuming, and Child Health Plus is for the kids.
Yeah, Child Health Plus is for the kids from 0 to 19. Then after when they reach 19, we can transfer them from Child Health Plus to whatever. It's either Medicaid or Family Health Plus, which is essential plan. It depends on the income. Right. And the kids, they can be and their parents, until the age 26.
Oh wow! So let's go about that. So a child, basically from the birth through the 19th birthday or the 18th birthday.
Yeah, they can be in Child Health Plus or Medicaid.
Right.
If they are under Child Health Plus, when they reach 19, then they're gonna be transferred either to Medicaid or to Essential Plan. But it depends of the size of the household and the income of the parents. And they can be enrolled in the parents' income until when they reach 26.
Okay. Do they have to be in school?
If there is any, if they move out from the house, if they start working, if they have their own income, then it's a different story. Then we can do separate application.
For themselves, okay.
For themselves, yes.
Now, going back to the kids, and we'll talk more about the adults. So for the children, so I'm a parent, I have 2 kids, and I want to apply for the program. So what do I have to bring to you? I mean, how do I go and get an application process?
Okay, if you're parents and you have 2 kids, you can come to me. Then you have to bring your documents, your income, and we see what's the kids they are qualified for. Either for Child Health Plus, and there is program for Child Health Plus. There is a free program, and there is categories. You can pay $9, you can pay $15, you can pay, and it goes up to $300 per month.
So if you meet what we refer to as poverty level,
the income, yes.
Right. So if you have a lower poverty level, you're actually free. And then if it goes up, you pay certain monthly premiums.
Certain amount, yeah. And also it depends also on the size of the household. If you have 3 kids, then if you're paying $9 for each kid, you're paying $27 for all of them. If you have 4 kids, you pay only for 3, and the 4th one is free.
So basically,
it doesn't matter how many kids. Even if you have 10 kids, you pay only for 3.
$27.
Yes,
that's not bad. That's not bad.
That's why they call it affordable.
Right. Well, yes. I mean, it is. I mean, it's and people don't know about this particular trick. I mean, a lot of people may not know about this, but there's a trick where, people think that Child Play is only for people that don't have any income or low income. But to your point, Rachida, I think you can make a lot of money and still be able to pay. You're just going to pay the highest premium.
That's it. Even if you make $1 million, and you're going to pay only $300 for each kid. A lot of people, they don't
that's actually cheaper than going to regular insurance,
yes,
through commercial
of course.
insurance.
And you don't have to pay no premium, no co-payments. No, actually, you're gonna pay premium, but no co-payment, nothing. The
Right.
only thing you're gonna pay the health insurance, the premium. That's it.
And it covers you for primary care, specialty, hospital,
Everything. It
medication,
covers everything. Yes.
It's comprehensive. Dental,
Everything.
everything.
Everything. Emergency.
I want to be a kid right now to sign up.
You're welcome.
But that's so for our listening viewers. I mean, as you can hear, it's pretty accessible, and so Child Plus, for at least your kids, you know that you can have coverage for them guaranteed. Doesn't matter if you choose, let's say someone is making money and they choose not to be insured, whatever the case may be, although the rules have been up and down, because under Obama, you had to actually provide coverage and proof of coverage. And then under, Trump's administration, I think that changed and got removed. But for the adults, but for the kids, you're covered no matter what. You just have to apply for it. And again, it depends on the size of the household as well as your income, or your parents' income, or you as a head of households. Your total income for the year is going to be qualifying you to a level, and based on that level, you'll pay whatever the premium is. And again, it seems that even at the highest level, it's still affordable, because if you compare that to a regular commercial insurance, to a job or your personal buy-in, it's still expensive. So again, that is a great offer in the marketplace. It is a great program that's been there. Actually, I've worked under with Child Plus years back, before I moved into the senior markets. And again, it's always been similar in concept. It got even better over the years. And again, to the extension that if children are still in their household, as Rachida stated, they will stay home. They'll still get the coverage while they're there. They don't have to worry about it. And then, of course, if they work and they become independent, emancipated, they leave on their own, that's a different story. They become adults themselves and, responsible. Therefore, they can buy their own coverage, but they can still qualify, and I guess Rachida can help, and, agents can help in that aspect to get them into the Family Health Plus or the actual affordable care, like Essential Plan, right?
Yes, and I can add something also,
Please,
like
yes.
even the case from 0 to 19, if they are undocumented, they are eligible for this program.
Wow. And that's a big piece, and we're going to cover a little bit more on the bilingual version of this show. But really, for anyone that's listening and watching, if this is important, if undocumented children, there is no requirement to prove citizenship or resident or immigrant status and all that stuff. You are covered under the law, and you can get, especially if you're going to school, you're going to need your immunization shots and everything. And so, and in New York State and in the federal government, if you qualify under those things, those guidelines, you will be able to get into the coverage without any questions asked. Same concept, your birth certificate to show the age, your income bracket to give you the actual levels. And I'm assuming for undocumented there is no cost, or it also depends on
it depends also, like if their parents they're working and they have they can also, it's the same thing. Okay. The only thing we don't ask for like the immigration status, and it's affordable for all the kids. Actually, kids they need to have insurance.
Well, we've learned one thing in COVID-19 is that viruses don't know the difference between citizen and non-citizen. Actually, everybody is vulnerable. Everybody gets sick. So ultimately, we don't want any children to. And plus, these are kids that live here, reside here, they go to school here, and they deserve to actually have the same health care as others. Some people may have a problem with this concept. We're not talking about adults that are just taking advantage of the system. We're talking about children that are here with no fault of their own because their parents happen to be here. Whatever the circumstances, we're not debating the immigration reasons for them and that, but we're talking about the way to get help and be safe and be healthy. And therefore, again, if they are in the community and they get sick, that could be a problem for all the community. And therefore, the government does allow these options, and it is qualified under the federal law and the state law. So Rachida, that's great stuff in terms of CHIP, and so Child Plus. And now that's available. Obviously, you can do this across the whole city, but it's available in New York State. For those of us, for those of you watching or listening in nationally, the Child Plus program is not restricted only to New York. It's actually in all the different states. Each state governs it differently and administers similarly to the New York. You'll have to seek, the information in the local agencies in your state, and they'll be able to assist you with information on how to proceed and get the coverage. So going back to the next level, so now I am turning 19. I am, that's it. I'm no more a kid. You know, what is the option? So you said Family Health Plus and or Essential Plan.
Actually, they don't call it Family Health Plus anymore.
Well,
I
I've
know.
been, it's been a while. You can tell I've
You're
left a
not
lot.
you're not updated. No.
I know. You see, well, that's what we're here today.
They call it Essential Plan right now.
So
It's
Essential Plan.
Essential Plan, and Essential Plan, it's four categories. There is Essential Plan free. You don't pay, like it's $0. There is Essential Plan, which is Essential Plan 4. There is Essential Plan 3. Either you pay for like medical or you pay for dental and vision, which is $20 for medical and $31 for dental and vision. There is also like a Essential Plan 2. This one you pay, it's similar as a 3. Like either you pay for like medical, you can have medical free, and you pay for dental and vision.
Okay.
There is also Essential Plan 1. Essential Plan 1, it's you pay like for medical and dental and vision, which is like $41, which is affordable, I think, for everyone.
Now again, it's all income based. So with these things,
Yeah, it's depend of your income and also for the immigration status.
so for the ACA, you do have to have a certain requirements for residency in
Yes,
in immigration?
if you have a green card and you've been here for 5 years, actually before 5 years, then you are eligible for Essential Plan. When you reach 5 years in the country, then you're gonna be transferred from Essential Plan to Medicaid.
To regular Medicaid.
Regular Medicaid, yes.
Okay, so wow, that's good to know. Now that's a big question. So for someone, you mentioned Medicaid, and we'll talk about that in a minute. Someone who does not have any paperwork, or they just happen to be in the country and something happens on a tourist visa, do they qualify for anything? Is there any program that covers them?
Yes, for like tourist visa, they are qualified for like certain time, for 6 months. They are eligible for Essential Plan 4, which is they don't pay nothing. It's $0, and they can go to the doctor. They can go to the specialist. They can go to emergency room, dental, vision. Everything is covered, but only like for certain time. They have to provide like a valid passport. If it expires, no, they're not gonna. They're not gonna be eligible. It has to be like a valid passport.
So someone that comes in as a visitor, like right now, we've had people that visit the States, and with the ban and everything is closed, people are get stranded. So
Yes.
if they get sick, they will be covered.
They are eligible. Yes.
So do they have to apply, to get the coverage, or they can just, for example, go seek the coverage and then get the ball rolling with the insurance process?
They can call me, like like CAC. They can call any CAC. They can apply.
Okay. And if they go to, let's say someone in the same case, but they happen to go to the emergency room, for whatever reason, right away, and does that somebody else take care of it? How does that work?
Okay, if like somebody gets sick and he goes to emergency room and he doesn't have no coverage, then there is like they can apply for emergency Medicaid.
So that's different.
Yeah, this is a difference.
So that's different. That's only in case of emergency. But if they don't have anything, they can get the Essential Plan within 6 months, as long as they qualify with their passport and everything.
Yes, yeah. Mm-hmm.
See, I didn't even know that. That's good stuff.
A lot of things change, like in this like 2 years now. A lot of things change.
Now, I mean, again, I personally been a little bit far
A lot
from.
of changes, yes. A lot of changes.
So, but that's good. I mean, again, one of the reasons I wanted to cover this topic today is really because I know, first of all, not only because I have been far to it, but it really there's a lot of information, there's a lot of offerings and options out there that people may or may not know, and a lot of people probably would not know, or at least may not know how they go about it and who qualifies. I think today it does clarify for us, to a degree, where who is qualified, what age, what do they need, their immigration status is important, and so. That's excellent. Now, is there a state requirement? So if I live in Jersey, can I actually apply in New York?
No.
So you have to be resident. Yeah.
You have to be New York resident, because you have to provide like a proof of address in New York City.
So the residency rule is what, 6 months and a day? Is that what it is? Yeah. So you have to justify the residency just
You
for
have
the.
to yes, of course. You have to provide like a proof of address. You have to provide the proof of like your passport. You have to provide like a phone number and your proof of income if you're working. If you're not, then just we don't provide like your time. Like when we were doing like an application, like paper application, we were like asking people to provide like proof of income. They have to write a letter, whatever. It's not anymore with the marketplace. Everything like we take people's like word.
Wow. Okay. Well, again, I mean, if people have to do the right thing, otherwise,
Yeah, that's it.
it's up to them.
And
Yeah.
if there is any, if the marketplace they they found out like if there is any like
They'll drop the person from the coverage.
yeah, they of course they're gonna ask those people to provide like documents.
Right. No, I mean, again, it's fair. But the reason I was asking the question is because, again, you have, people from local other states, Connecticut, for example, and Jersey, if they just move into the state, can they be eligible immediately? Like, let's say I really moved to New York from Jersey
Of
to New York.
course, from
Yeah.
day one.
So
As soon as
as
you
long as
move on to New York,
that's it.
you're gonna be eligible for health insurance in New York.
Okay, good. So perfect. So
There is also one subject I want to talk about it, like a
sure.
pregnant woman.
Yes.
Pregnant
You need to
woman,
do it.
if she's undocumented, she's eligible for Medicaid, not for essential plan. Even if she's here, like she just came into the country, if she's pregnant, then she is eligible for a PCAP program, which is Medicaid.
So that pickup's still on, still active.
It's still on, but it's through the marketplace.
Okay. All right. Good. So again, that's another piece of information. So again, there is coverage for everyone, literally, and it seems that there's coverage for whether you have documents or not, depending on your status, your health needs, and so on, your age. All that stuff is actually pretty good to know. And for the communities, if you're listening in, it doesn't matter what community you're from, and you do need, or someone that may need the coverage, what's available. Of course, Rachida is available, and we will make sure that we get your number and your information so people can seek the assistance through you, and you can help. I know you've helped a lot, so it's always a good thing to actually have that feeling that you've assisted a lot of people to get coverage. I mean, we all experience, health needs, and sometimes when you don't have coverage, that's a problem. It can be very costly, and these programs are available. And again, there are rules. Obviously, you have to follow the rules. You have to submit the right documentation, and as long as you provide the right documentation, you're in the program. And now, is there a recertification, a renewal every year for these programs? Is 6 months? What's the period?
Yes, it depends of your, the state. Sometimes they send you like a letter, like after 4 months or 6 months or 1 year.
So depending on which program you're in.
Yeah, to recertify for the program. And it depends also for your income. Sometimes maybe you are eligible for Medicaid, but like in 1 year you're gonna have like you're gonna find a job, your income will change. Then it based on that, those information. Then either you're gonna be eligible for other programs or you're gonna stay in the same program. Some people, if they don't, there is no changes in their life, they can be automatically, renewed. The state, renew their insurance like automatically. They don't have to to go through the system.
You don't have to provide anything. So they already.
No, they don't have to provide anything because
Okay.
they, and like the state, it's like they know if they check your social security number, if you're working, if you're not, if you file
Right.
taxes, if you're not,
So they do have access to information, and they can deem if they feel that they need more documentation, they request it, and then
Of course,
you have to
they will.
submit it. Now, of course, if you do not qualify the second round, I mean that's when you drop from the insurance, unfortunately. But now for children, that doesn't apply. I'm assuming because their status is different, right?
It's different, yes. It's different. No, yes, it's different because they can be eligible for Medicaid, but if the parents their income change and it goes up, then maybe they're going to be transferred from Medicaid to Child Health Plus,
And then they'll pay the
either for
premiums.
free or they have
For the
to pay like those premiums, like I told you, from 9 to, to
Well, I mean, as a parent, you do. I mean, we all worry more about our kids than ourselves, and the most important people we want to have at least all the time coverage for is your kids, and also kids play, and there's a good chance they get hurt. They don't pay attention to themselves as much as adults do. They can get sick quickly, so it's essential to have them actually always with coverage, and just in case something happens, they have it. So that's excellent, Rachida. Thank you for all
I want to
this.
mention something. Yeah. I'm sorry, we didn't mention. It's about the age.
We have time.
This program is only from 0 to 64 years old.
Yes.
When you reach
that's where we come in.
This is your job.
So this, at 64, when you turn to 65, then you go basically to Medicare and other type of options, or maybe no options, depending on a lot of factors. I mean, everybody's qualified for Medicare technically. It has its own requirements, and we've covered some of that in different shows, and there will be a lot more discussion coming up in the next couple of months as we get closer to the annual election period for Medicare. But thanks for bringing that up. I mean, it is everything is with has its age brackets, and you qualify a certain point of your life for certain programs, so it's not for everyone at any given day. Now, Medicaid in general does qualify, and there is no age to it as long as the resources and the income are qualifying you. So
and there is also a guideline we go by. I can show it to you guys. This is the guideline we go by. This is the size of the household, and this is the percentage, and this is how like the income, and then we go by this. So this is coming from the states.
So the state has an actual guideline table with your size of household, and then your income, and then your premiums. So this way, everybody that basically you just look across, see where you are in terms of how many kids you have, the total family size, and then you go to the income bracket, and it's gross income, I'm assuming, or is it net income?
This is the gross.
So basically, that's the other thing. So it's based on gross income, not net income, which means it does actually get a little bit more, gives you more chance, because technically net income will be after taxes, will reduce your overall money. But if you use the gross income, typically it's at least 20-30% up or higher. So it brings you to the next level potentially. So again, that's just another piece of information that can help. So any other questions, or at least things that we want to cover on the English version, so we can move on to the Moroccan version? Are we good?
Yeah.
Okay. So for our listeners, I'm sorry, say that.
Do you have any question? Other question?
No, I think we've covered a lot of grounds, and all the different options, programs, and and again, the requirements are very clear: your date of birth, your address, your documentation if you need to, and that's about it.
Yeah, I just want to mention something about people. Some people, they call me, they said, I used to have Medicaid with the HRA, then now they cut my insurance, and I don't want to be under the marketplace because I don't want to pay, or I can't afford it. This is a wrong information. People, they have to know, marketplace, it's for everyone. Either you're going to be eligible for Medicaid, it's the same program, nothing changed, only the program changed from Medicaid, HRA to marketplace, which is Obamacare. But a lot of people, they don't know about this. They're confused. We've been working from Obamacare, from 2014 up to now. A lot of people, they don't know the program. They don't know how, and we try to explain to them. We try to tell them, it's the same thing. And if you lose your insurance from the HRA, you can't go to HRA and apply, no more. You have to apply through the marketplace. Even if you go to Medicaid office, they will tell you, go to any CAC and apply, or navigator or broker.
So
and
HRA is the
they
human
get afraid,
resources.
and they get scared, and they don't apply, and they stay without insurance. And when they get sick, they go to the hospital, then it's a disaster.
Yeah. Well, again, from this platform, and thank you, Rachida, for highlighting that. I mean, it's important to know that, again, these are health coverages available to you. You're entitled to them as long as you qualify. You should not be worried about who's what, where. seek the advice, seek the agencies. There are agents out there, such as Rachida, that specialize in these, programs. They can help you. They can give you the right guidance. Don't just take it for granted and say, okay, I'm afraid to do this or the other. Find out first before you actually make that decision. Hopefully, you will always have the right, answers, and you will get the actual things. And again, you can avoid a critical problem, because if you do go to a hospital and stay in a hospital, that, God forbid, that can be a very expensive bill. And, just dealing with it, even if you get qualified later and maybe there's some sort of retroactive coverage, it can be a problem. So let's not go there. Again, don't let yourselves with that insurance. Make sure you always go. Your health is important. Your health care, is going to be paid somehow. And, if you can't, buy your own insurance and you qualify for programs that are available to you, you should actually go for them. And so, again, Rachida is one of the specialists that do this. And, again, reach out to her. If she can help you, she can. I mean, she can help anyone in New York City, right? So for those that are in Jersey or other states right now listening to this or watching this, there are Rashidas everywhere. So you can seek similar agents within your state, your city, and your jurisdiction, and be able to get similar stuff. The Obamacare or the ACA is actually a federal program, so it's across all states. There are different administration of the programs based on the regular, the local states, but it is still, a federal program. So the qualifiers are the same and should not change from one place to the other. So again, there are programs for everyone. Don't stay without any coverage. If you have to get insurance, we do need insurance anyways, because you can't really go to a doctor these days without paying anything. And it's not so much about your primary visit, or maybe you can say, I can pay the doctor, I can pay a couple of prescriptions. If your health is actually needing a lot more, intense stuff, and you do need some specialty providers and stuff, it can get very costly quickly. Especially with advanced, chronic diseases, diabetes, and cancers and stuff like that. You got a lot of issues there and a lot of costs. Hospitalization can be very costly. And again, insurance is there to cover these costs, and there are programs available literally from the day you're born to your older age. So it is important to know all the options, and we will cover all these options in the channel. And hopefully today was a great actually session to share with us what's available under 65, because we've covered a lot of the 65 and above, but today we've covered a lot more on the younger folks and the folks that just in an age group where they actually work in, and they may not be getting coverage from health plans, from their companies rather, or commercial plans. So that's great information, Rachida. Thank you. So that being said, if we don't have anything else to add here, we're gonna translate now the show and turn it into an Arabic dialect, and hopefully we'll be able to do the same thing and share with the community. Now, Rachida, السلام عليكم.
وعليكم السلام.
قلبها مغربية دابا.
باش يفهموا الناس اللي مساكن اللي ما كيعرفوش الانجليزيه، نحاولوا نفسروا لهم هاد البرامج باش حتى هما يفهموا.
So ان شاء الله دابا غنهضروا شويه بالعربيه. الناس اللي العرب من جنرال او المغاربه اللي هما في الولايات المتحده وخاصه في نيويورك، من منطقه نيويورك. رشيدة طبعا مندوبه ديال لاسيورونس في نيويورك، معروفه، عندها واحد الخبره كبيره في الميدان، وكتساعد بزاف الناس في الكوميونيتي ديالنا، في المجتمع المغربي هنا في نيويورك. وعندها كاين برامج كثيره اللي كيمكن لها كتساعد الناس اللي ما عندهمش تامين صحي. ورشيدة بيان سور انت غتكلمي معنا على شنو هما شكون الناس اللي الكواليفايرز اللي غادي شنو خصهم هما يجيبوا كاوراق ولا هذا وثائق اللي غادي تجعلهم يسجلوا في هذا المجال هذا او في هذه التامينات. شنو هما انواع ديال التامينات اللي كاينين بعدا بالنسبه للناس اللي غاتجاو اللي مازال ما عارفينش؟
اللي ما عارفينش، كاين الناس الجدد اللي غادي يجيو مثلا هاد اللي نو كامرز اللي كنسميو حنا نو كامرز الجدد القادمين الجدد، هادو كيجيو اصلا غير كيدخلوا كتكون عندهم كيطبع لهم اي سي سميتو، كيطبع لهم النمبر ديال
فيزا.
نو ماشي الفيزا، ديال الجرين كارد.
اوكي
اي سي نمبر، اتس اي سي نمبر، اي نمبر sorry
اي نمبر اللي هو الالين نمبر.
اي نمبر هذاك اللي كيطبع عليهم في الباسبور، وكيدخلوا مثلا نيويورك. اون فوا بلا ما يقدموا لا سوشيال ولا لا حتى شي حاجه، يعني هما راه اوريدي اليجيبل على هيلث انشورنس. وبزاف الناس ما كيعرفوش هذه القضيه، فكيتسناو كيجلسوا وكيتسناو حتى تجيهم الجرين كارد وحتى تجيهم السوشيال سيكرين الكارد، عاد باش كيقول لهم شي واحد ولا كيخوفوهم قبل، كيقول لهم نو ما عندكمش الحق تقدموا مادام ما عندكش السوشيال، ما عندك مازال ما جاتكش الجرين كارد. فكيبقى هوايا مسكين جالس ولا مسكينه جالسه كتمرض، كتولي خايفه تمشي للوبيطال لان كيقول لها لوبيطال راه غالي بزاف، فكيبقاو مساكن ما محيرين ما عارفينش شنو كيديروا. كاين اللي مثلا شي واحد اللي كيوريهم كيقول لهم شنو ديروا، كاين اللي كيمشي كيقلب بوحديتو الا عنده شويه النولج ديال جوجل وهذاك كيقلب كيلقى مثلا كيلقاني انا ولا كيلقى شي واحد كيعيط. كان هذيك الساعه كنشرحوا ليه كنقول ليه مثلا غير اون فوا تاخذ باسبور ديالك كيكون اجي لعندي انا نصوب لك اسيورونس. الاسيورونس ما كتاخذش بزاف، تقدم عندي اليوم عندك 24 اور غتطلع لك لاسيورونس، عليك صافي السي اي نمبر ديالك كي كنبغيو تمشي للطبيب ولا تمشي
كاع مثلا يعني فريمون اليوم دون دو جو
سهله. دابا ما بقاتش كما كانت ديال زمان اللي كنا كنديروا حنايا بيبر ابليكيشن شهر ما كتبقى من 45 يوم حتى 90 يوم، ما بقاش ديك القضيه.
دابا كتابلاي صافي
كتابلاي سير بلاص كتخرج لك لاسيون، لا غد لي كتخرج.
نعم
خير عندك هذيك ديك النمبر. وهذه بزاف الناس ما كيعرفوهاش. كاين ناس اللي كيجيو مثلا توريست يجيو هنايا عندهم الحق حتى هما واحد الوقت انهم يقدموا، غير خص تكون عندهم الفيزا ديالهم فاليد وتكون الباسبور ديالهم فاليد، حتى هما كتطلع لهم واحد لاسيورونس ولكن ماشي ميديكيد، كيطلع لهم واحد البروغرام سميتو اسينشال بلان، ما كيخلصوا فيه والو، حتى هو بحال الميديكيد. كيمشي للطبيب، يمشي سبيسياليست، يمشي لطبيب العينين، يمشي للورجونس، يمشي سنان كلشي عنده فابور ما يخلص فيه حتى شي حاجه، كياخذ الدواء ديالو، كياخذ كلشي فابور. كاين المراه الحامله اللي كتجي مثلا، كاين بزاف العيال اللي كيجيو ولدوا هنايا حتى هي عندها الحق ديالها غير اون فوا كتدخل البلاد هنايا كتجيب غير الباسبور ديالها ولا دغيس هنا في نيويورك وعندها الحق انا نصوبوا لها اسيورونس، غير هي كيطلع لها ميديكيد ماشي اسينشال بلان، لان هي كتسمى بحال بيكا بروغرام، لان المراه الحامله خصها تمشي بزاف للطبيب، خصها دير بزاف التحاليل، فكيكون هادشي كيكون الولاده عاد باش الولاده، فالميديكيد هي اللي كتكون كتخلص على هاد كلها، وكتبقى عندها لاسيورونس ديالها حتى تولد وكتكمل واحد شهرين، وعاد باش هذيك الساعه كيصيفطوا لها الرينيول تجديد. بغات تجدو هي هذيك بقات مثلا جالسه هنا، ما بغاتش هذيك الساعه كتقطع عليها، ولكن لو بيبي راه كتبقى عنده اسيورونس العام كله.
ومن بعد البيبي كيمكن له يدخل تشارها بلاص كيما قلنا،
لا كيطلع له ميديكيد
ميديكيد في الاول، ومن بعد الى واحد
هذاك حسب الانكم، يعني الدخل ديال لي بارون ديالو. هذاك كاينين هذا البروغرام ديال تشايلد هيلب بلاس ديال لي بارون اللي عندهم الولاد بعداك اللي ما عندهمش الوراق، يعني جاو لهنا جاو لهاد البلاد مع والديهم وما عندهمش لا جرين كارد، ما عندهمش لا ورك بيرميت لا والو، ما عندهمش السوشيال، فعندهم الحق في هذا البروغرام من زيرو حتى 12 عام. من بعد كيتحول هذاك البروغرام للاسينشال بلان.
19 عام قلتي؟
19 عام.
لا هنا ما سمعتكش، اسمح لي.
19 عام.
اوكي. دونك هادو معلومات يعني واجب خصنا نعطيوها للكوميونيتي ديالنا، ولا يعني الناس هم يعرفوها.
الناس كلهم يعني ماشي غير الكوميونيتي المغربيه، يعني انا كنتعامل مع لي كوميونيتي كلهم، العرب كلهم، انا كنتعامل مع الفايف بوروز في نيويورك كلها، فاي واحد عنده اي سؤال هذا يتصل بيا وانا راه الاشاره، ما كاين حتى شي حاجه. طبعا
هذه البرامج موجوده للكل. احنا اليوم خصنا هذا المقطع ديال هذا البرنامج بالدارجه المغربيه يعني الجاليه المغربيه اللي مقيمه هنا في نيويورك بالاخص، ولكن كما قالت رشيدة ممكن هذا اللي عندكم شي جاليات اخرين اللي كتعرفوهم او اي حد كيسمع هذا البرنامج هذا، يعني اتصلوا بالاخت رشيدة وهي غادي تساعدكم على هذه البرامج هذه. يعني ما كتاخذش الوقت كما قالت رشيدة، يعني اصلا انه اليوم تقدم على برنامج ديال الصحه وغدا تبدا، راه ما كاينش حتى في الكوميرشال. يعني ملي كتكون عندك لاسيورونس ديال الشركه اولا كتشريها راسك، راه كتبقى تعين واحد المده عاد كتبدا. يعني على الاقل اللي قدمتي اليوم كيقول لك من شهر بدايه الشهر الجاي عاد كتبدا لك الكافرج ولا التغطيه. اذا هذه البرامج راه كلها مزيانه، واي واحد اللي يعني تجي الفرصه انه يخصوا هذه المعلومات هذه، هي رشيده معنا تعطينا المعلومات ديالها دابا شويه، واتصلوا بها في اي وقت. هي ديما طبعا حنايا في المجال المبيعات ومجال ديال هذا الشيء ما كاينش توقيت. طبعا ما غنعيطولكش الليل، ولكن واش انت ما عندك الاكس الوقتاش كيمكن لك تساعدي الناس. ما بغيناش الناس يعيطولك في اي وقت.
والله الا كيعيطوا لي وقت ما ماشي مشكله عندي. بعض المرات الناس كيعيطوا لي من بعد الخدمه، كيعيطوا لي في الويكاند، كنجاوب. بعض المرات ما كاين حتى شي مشكل، كنعرف الناس بعض المرات كيكونوا كيوحلوا، كيمشي للسبيطار، كيكون عنده شي مشكله، فكيحاول لانه كيعيط لك. يعني ما فيها باس انني غادي نجاوبو، غادي نعاونو. انا هذه طبيعتي. انا
تبارك الله عليك. هذاك هو المهم، لان اصلا كما قلتي هو انا بالعني سولت السؤال باش نجبدوا الهضره، ولكن هي في المجال ديالنا حنايا، يعني حنا في الخدمات. يعني طبعا اي واحد كيحتاج مساعده كنساعدوه. طبعا يعني كاين الناس اللي كتكون محتاجه او غيعيطوا لك، ولكن غير تصل برشيده وراه هي ان شاء الله غادي دير الواجب كامل وزياده، ما خافوش عليها.
كاين تليفون، كاين واتساب، كاين فيسبوك، كاين انستغرام، كاين ماسنجر. يعني انا التليفون ديالي موجود، كاين معروف. يعني ما كاينش اي واحد بغى يتصل بيا اهلا وسهلا.
صافي. دابا اليوم غادي يعيطوا لك.
اهلا وسهلا، مرحبا، والله الا مرحبا.
المهم حنا دابا طرقات رشيده لبعض الامور. تشاهد بلاص للاطفال، السيدات الحوامل اللي هما كيجيو للبلاد هما مازالين عندهم في حمل. ولكن في هذا السؤال بعد هذاك، واش الحمل في اي وقت يعني يمكن لهم، ولا واخا يكونوا مثلا جاو مؤخرين في الحمل ديالهم، اولا في البدايه ما كيهمش؟ كاينش فرق؟
ما كيهمش، واخا تجي يلاه عندها 9 شهور، تجي عندها 9 شهور عندها الحق انها تصوب.
يعني قبل الولاده غتابلاي وغادي يمكن لها. يعني الا وصلتي لهنايا راك ما تخاف.
مثلا كاع ولدات جات وفي الوقيته دخلت مثلا لامريكا ومشات للسبيطار، يعني مشات جات الطلق ومشات ولدات، عندنا الحق انها نصوبوا لها اسيغونس وهي والده
ديريكتومون.
والميديكيد كتخلص لها 3 شهور قبل.
ها انتم ما سمعتوا، ما نزيدوا حتى حاجه على هذه كافيه، راه كتغطي لنا
كما كيقولوا God bless امريكا، ياك
God bless America. وهذه ما كايناش عندنا حنايا unfortunately. نطلبوا الله مع الوقيته تكون.
ان شاء الله يا رب.
احنا الراميد راه هو الراميد في المغرب راه تقريبا هو كوبي صغيره د هذه البرامج اللي كاينه هنايا. يعني تقريبا صغيره، يعني واخده نفس الصفحه ديال الميديكيد امريكان. ولكن يعني هذا البرنامج حنا كنهضروا كتسمعوا، ممكن الناس اللي كيسمعونا حتى في المغرب دابا شافوا هذا. الناس كيسمعوا بان راه البرامج الصحيه في امريكان شويه صعيبه وما كاينش واحد تغطيه وهذا كاين وما كاين. لان كاين الفكره كاينه عامه، ولكن ماشي صحيحه 100%. لانه هنا التغطيه في امريكان الناس اللي محتاجه كتاخذ، الناس اللي عندها دخل محدود كتاخذ، كاين عندها كلشي. كتبقى واحد الطبقه اللي في الوسط اللي اصلا اللي كيكون عندها مشكله ديال التغطيه مع اوباما كان منين دارت هذيك براسهم، حتى هما عندهم فرصه انهم على حساب وغيخلصوا طبعا، ولكن كاين تغطيه كافيه انهم يبقاو عندهم يعني الا مشاو للتامين الصحي يمشيو للطبيب، يمشيو للسبيطار، ياخذوا الادويه ديالهم. لان الادويه غاليه طبعا، واطباء هنا غاليين، وخاصه اطباء الاخصائيين. او طبعا المستشفيات هنا اغلى ما يكون. يعني او العمليات.
وغير الا جات الامبولانس وهزات شي واحد، راه يكوست لك شي $500 تقريبا، غير باش ديك غير من دارك لورجونس. عاد باش الا زدتي مثلا شافك شي طبيب سبيسياليست، لي زاناليز غاليين بزاف. عاد الا شافك طبيب ومشيتي عطاك الدواء غالي واحد الدرجه لا تتصور. فهاداك الشيء علاش انا كنصح الناس كلهم يكون عندهم تامين صحي.
نعم. طبعا يعني ما كاين علاش الواحد ما يكونش عنده تامين صحي. يعني انت هنا وكاين البرامج موجوده، الواحد يكون عنده، اللهم تكون عندك شي حاجه يعني ترجع لها في الحاله ديال الخطر، او في الحاله ديال لورجونس او الاستعجالات المستعجلات، او لا تبقى هكاك حتى توقع الحاله وديك الساعات كيكون تروطل. يعني تقدر يعني الا ما كانش عندك في الوقيته، راه حنا كنهضروا على السيدات الحوامل اللي كيجيو، هذاك حاجه، هذاك كبارتيكولي كما كنقولوا، حاله خاصه. لكن في الناس العامه الا مرضتي وجيت طبيب ما كاينش اللي غادي يخلصك ريترو هذاك الكافرج اللور، الا كنتي طبعا ميديكيد وهذا، ولكن هذاك تغطيه مختلفه وخاص يكون دخل قليل بزاف الحوايج. المهم احسن حاجه هي اتصلوا باخصائيين كالاخت رشيده، هي غادي تعطيكم كاع المعلومات من ا تال بي تال زد تال زد كما نقولوا ا زد، فهمتيني؟ وغادي يعطيك كاع الخطوات اللي خاصك دير وغادي تساعدكم في هذا الميدان هذا. وان شاء الله يكون الخير والصحه ديالكم تكون على في سلام وبخير. هذا اللي غنقول انا.
كاين واحد البروغرام عاوتاني غادي نضيفو ديال الناس اللي اكثر من 64 عام. يعني انا كندير من 0 حتى 64. كاين الناس اللي ما عندهمش مثلا ما عندهمش الوراق وعندهم فاليد باسبورت من 64 للفوق، عندهم كاين واحد البروغرام كيتسمى HHC، هذا ديال السبيطار ديال المخزن اللي كنسميوه حنا السيري هوسبيتال. نسيت ما نقولهاش قبيله، يلا تفكرتها دابا.
وي كان جو بعد
يا هذا البروغرام كيوفريوه السبيطار ديال الحكومه. ملي كيمشي كيديروا لك واحد لاكارت، وهذيك لاكارت يا اما كتخلص فيها واحد $20 ولا ما كتخلص والو، على حسب تو السن. فيها دي كاتيجوري، ولكن $20 باش تخلص تمشي تشوف طبيب، راه ماشي هي انا كتخلص 500 ولا 600 ولا 1000 ولا $2000. راه كيبقى دائما هذا الحل.
$20 خاصها في المغرب دابا باش طبعا.
يعني هذيك كتمشي للطبيب في المغرب راه كتخلص حتى 6000 7000 ريال
يعني ماشي غاليه، وفي كلينيك يعني ماشي واخا كلينيك
سبيطار. وهذيك السبيطار تقدر دير فيه كل شيء، يعني تقدر تشوف الطبيب، دير لي زاناليز تماك، دير حتى عمليات جراحيه. وعندهم هاد السيري هوسبيتال عندهم واحد البروغرام ديال لا فارماسي، اي دواء كما كان النوع ديالو كما كان الثمن ديالو كتاخذوا $2 $2.
انا خصني نتقيل معاك.
هاد الحوايج تو بي انس بزاف الناس ما كيعرفوهمش، ولكن الناس ملي كيعيطوا وكيسولوا راه كنحاولوا نوجهوهم.
يعني الحمد لله اليوم هذه الحلقه كانت يعني فيها استفاده بزاف والافاده للناس. انا بالنسبه لي استفدت بزاف بالمعلومات، لان شحال الوقت داز ما كنتش في هذا الميدان بالضبط ديال هذه البرامج هذه. كنخدم مع الناس اللي هما اكبر سنا واللي هما عندهم واحد البرامج اخرى. يعني رجعتني شويه للتاريخ والماضي. البدايه
20 عام هذه
20 عام هذه، ولكن طبعا تغييرات كثيره وقعت في هذه ال 20 عام اللي دازت. يعني هذه المعلومات كلها كاين فيها اللي تبقى هو تقريبا نفس البروغرام، غير زادوا فيه تغييرات، او كاين الحاجات اللي جديده. طبعا هذا اوباما كان كله جديد بالليفلز ديالو، يعني بالطبقات ديالو اللي موجوده. اذا يعني كيظهرنا راه حنا كافرنا غطينا بزاف ديال المعلومات دابا في هذا البرنامج، من ناحيه ديال الدراري، من ناحيه ديال كنا الدراري ما هضرش عليهم بزاف. يعني الدراري عندهم وراق، ما عندهمش وراق، والديهم خدامين كيخدموا الوراق ديال الريزيدونس ديالهم،
عندهم اسيورنس، يعني عندهم
وليميغراسيون ما عندهاش حتى مشكل مع هذه القضيه. يعني واحد مهاجر ما عندوش الوراق ولا مازال خدام في الوراق ديالو، ما تخافش ولا ذكر، ان شاء الله يكون عندهم تغطيه صحيه كامله. يعني واخا تقدم ما كاين اللي غادي يرابورتي لتا حد، ما عندهمش الحق يهضروا، ما عندهم يسولوا عليك والو. هي ميزه كاين عندنا في امريكان اصلا ان جنرال، هي تمشي لاي طبيب ما يقولكش خلص عاد الدواء عاد تخلص. هذه كاينه حنا عندنا هنايا، ويعني من الميزات. يعني طبعا دول اخرى تقدر تكون احسن، ولكن يعني ما كاينش يسوعك الحق ديالك ملي كتمشي اي كلينيك او لا سبيطار ولا مستشفى او لا طبيب خاص. يعني كتدخل الا كانت اورجونس وشي حاجه لازم يشدوك، ولا كان طبيب السبيطار عامه يشدوك، يصيفطوا لك البيل من بعد وتفاهم معاهم ودير كاع بايمنت بلان وتعطيهم تقسيط على شي حاجه ممكن. ولكن البدايه انهم انت الاول تدخل بعد التعالج وعاد نهضروا معاك على الفلوس. وهذه زعما نطلب الله واحد النهار تبدل عندنا في بلادنا لان فورشنلي في المغرب الا ما عندكش شهاده، انا جربتها مع الوالد ديالي الله يرحمه. كان تحط شاك عاد تدخل الكلينيك. يعني نطلب الله الا سمع شي واحد هادي، الا كان شي تغيير في هذا البرنامج الناس تساعدهم بها راه ممكن. المهم حنا عندنا في امريكا هنايا، والجاليه المغربيه الحمد لله نتوما هنايا ان شاء الله تاخذوا هذه المعلومات وتعاملوا معها، واي حاجه خاصكم هي رشيده معكم. ما تخافوش. تعطينا النمره ديالك رشيده؟
بيان سور بيان سور.
يلا جو هيد.
دابا
يلا
347 651 7603 347 651 7603.
دابا نحطوها في
طيب كتبقى باش
لا دخلتوا اليوتيوب غتشوفوها، لا دخلتوا الفيسبوك غتشوفوها، وان شاء الله يعني
انا الفيسبوك ديالي بالاسم ديالي رشيدة شلال.
صافي سهله. صافي ايزي.
ايزي.
وطبعا ما كاينش الفرق ما بين شركه وشركه، لانهم لاسيونس هي الاطباء تقريبا عامه هما كاين ياك.
ما كاينش فرق في شي حاجه، شي اختلافات صغيره ماشي بزاف. الفرق هو ان في الاطباء يعني كاين طبيب مثلا كياخذ هاد لاسيونس ما كياخذش هاد لاسيونس، هذا هو الفرق الوحيد. فكاين ناس مثلا هاد الطبيب كياخذ مثلا يونايتد، كياخذ مثلا فيدالس، كياخذ افينيتي، ما كياخذش امباير. فهذه هذا هو الحاجه الوحيده اللي كيلقاو المستهلك، كيلقى مثلا الممبرز كيلقاو هذه المشكله. مثلا كيكون عندك طبيب متبع معاه وعنده هاد واحد لاسيونس، كتسالى الكونطرا ديالو مع هذيك لاسيونس ما كيبقاش ياخذها. هذاك الانسان كيولي مجبر انه يا اما يغير لاسيونس ولا يغير الطبيب.
نعم.
ولكن على العموم راه كتبقى كل شيء يعني ماشي مشكله، يعني يمشي عند طبيب واحد اخر ولا يمشي يبدل لاسيونس راه بحال.
نعم، ولكن كتبقى المعنى اهم حاجه هي عندك كارونتي
انك مكفرت.
التغطيه ديال التامين الصحي عندك 100%. انت كتختار اين شركه تكون معها. بون طبعا هي تخدم مع رشيده خدام مع الشركه ديالها، ولكن التغطيه عندهم الشركه ديالك عندهم نيتورك كبير ديال البروفايدرز ديال الاطباء، يعني منتشرين في كل مناطق نيويورك، ما تخافش عليها. ولكن الا في حاله ما كانش شي طبيب مختص او شي حاجه ما كاينش، راه كاين كل بعض اختارات حتى الشركه لاسيونس كتعطي واحد بحال قلتي اوتوريزاسيون خاصه، يعني كتعطيك واحد يعني بيرميسيون خاصه باش تمشي لهذاك الطبيب الاخر في الحاله اللي كتحتاجها. يعني كاين بزاف د الحوايج. طبعا ملي كتكون التامير كيكون عندك اكسي واحد الفريق اللي مور في الشركه كيعاونك الا عندك اسئله صحيه ولا اشياء. من بعد ما رشيده كدير المهمه ديالها وداك الشيء كتدخل انت المجال كترجع انت مامن. شركه التامين راه عندها برنامج خاص ديالها الداخلي اللي كتساعد به الناس والاسئله، وعندها خدمات الاعضاء وكل شيء. اذا يعني ما نخافوش على هذاك القضيه.
لا، وكاينه ملي كيكون عندك كدير له انشورنس كطلع له يعني من بعد 4 شهور ولا 6 شهور ولا 9 شهور كيجيه واحد رساله من الماركت بليس انه خصو يجدد لاسيورونس. كاين ناس بزاف اللي كتجيهم هذيك الرسائل كيشدوا كيشربوها وكيلوحوها لان ما كيفهموش، ما كيتصلوش بينا، ما كيتصلوش بالشركه، فكتمشي له لاسيورونس ديالو حتى ما كيعرف حتى تيمرض، حتى تيمشي للطبيب ولا كيمشي للوبيطال. عارف كيقول له ملي كيتشيكيو على لاكارت ديالو كيقول له راه ما عندكش لاسيورونس، ما كيفهمش هو علاش انا مشيت له لاسيورونس. كيعارف كيتصل بيا انا ولا كيتصل بالشركه، كتقول له انت ما جددتيش، كيقول لك لا انا ما جانيش تجديد، لان التجديد تبدل ما بقاش كما كان ديال ملي كنا ايام ديال الاتش ار اي كنت كتصيفط لك واحد الفورم كتعمرو بيديك ولا كنعمروه ليهم حنايا وكنصيفطوه. دابا ما بقاش كيصيفطوا لك اوتوماتيكمون، كيصيفطوا لك غير ايميلات كيقول لك اتس تايم تو رينو، يعني جاك الوقت باش تبدل. فانك انت غادي تتصل بهذيك ديك السي اي سي اللي الانسان اللي صوب لك لاسيورونس المندوب ديالك، غتصل به وغتقول له راه جاتني واحد لا ليتر جاتني. الا ما عرفتيش تقراها تقدر تصورها. عندنا دابا كلشي الناس عندهم سمارت فون، تصورها وتصيفطها كما انا كندير مع الناس ديالي كلهم، كنقول لهم صوروا لي اي ورقه جاتكم اي رساله صوروها صيفطوها لي كنقراها وكنشوف. الا لقيت عندهم انه ما عندهم التجديد انا كندخل للسيستم ديالي وكنجدد لهم. انا دابا هادشي غير نصائح كنقول للناس لان الناس ما كيعرفوش.
لا هذه نصائح يعني في المحل ديالها ولازمه، لان فعلا الناس انا جربت هذا الشيء. الناس بزاف ما كيكونوش عارفين وما كياخذوش واحد المبادره حتى كيكون فات الوقت فات الاوان، ومن بعد عاد كيتراجعوا. خصو داك الساعات في ذاك الوقيته اللي كيكون تحيد التغطيه كيمكن لها تكون مشكله، لان في ذاك النهار لاحظت توقع شي حاجه هما ما كانش تغطيها مشكل. اذا ما عمرك تخلي الا عندك مهما انت كواليفايد وعندك الاليجيبل، يعني ممكن تاخذ هذه التغطيه هذه شامله، خليها ما تخافش ديرها. خاصك ورقه تصيفطها غتصيفطها. رشيده راه موجوده غتقول لها هي شنو جاتني، غتقول لك اش غدير سالي. اوكي سو اختي رشيده ميرسي بيان على هاد الحلقه. راكي عطيتينا بزاف ديال المعلومات بوث ان انجلش وبالعربيه والمغربيه سبيسيفيكلي. اذا المتابعين ديال البرنامج شكرا على المتابعه. اي معلومات بغيتوها في هذا المجال هذا، هاي رشيده معكم. اتصلوا بها في اي وقت، مش في اي وقت طبعا وقت اللي يكون
ماشي اي وقت، ماشي
ماشي في اي وقت، يعني في الوقت ديال العمل.
وقت
حتى في
العمل.
كان ماشي مشكل. الا غنساعدوا شي واحد محتاج راه غادي تساعدوا، ما كاين مشكل. وحنا كذلك في القناه اللي عنده شي سؤال ولا شي حاجه صيفطوا لنا في الكومنت، ويعني ممكن حنا نساعدكم في المجال هذا. يعني احتاجتوا شي حاجه من غيرها سينو نقدر ندير لكم على رشيده وموتا. سو مع هذا اخر نقطه هذه ان شاء الله البرنامج غينتهي دابا. شكرا على المتابعه. بالنسبه نرجعوا للانجليش ديالنا. So thank you for watching the iHealth channel and listening on iHealth Radio. This is Hurricane H with guest speaker Rachida Chellal. We talked about the insurance world and health coverages for the uninsured and underinsured, which is a big thing, that's going on. A lot of people don't know what's available to them, how they can go about it. So hopefully today's session or today's, show did, shed a light on a lot of, important, pieces and items that are, health related, that can help a lot of people that may not know that they had the opportunity to get coverage to get it. So that being said, thank you for watching and have a great night.
Thank you, Hisham, for inviting me. Thank you so much.
You're welcome. It was my pleasure.
Thank you. And I'm here for everyone. You can call me anytime.